Welcome back to the show, everyone. I am your personal pincushion, Michael Eckford. Well, not your personal pincushion, but today I will
Dr.
serve.
Heidi's personal pincushion.
There you go.
You've met Dr. Heidi on the show before. She is a naturopathic physician and prolotherapist. And what Michael got
That's what
today
we're focusing on.
involved a few needles. How are you, Dr. Heidi?
I'm doing well, thank you.
So let's
How are you,
Prolotherapy,
Mike?
I'm
things off
fine.
and talk about prolotherapy. What is this?
it?
Prolotherapy is an injection technique that's regenerative, so it's for proliferation of new soft tissue, ligaments, tendons, cartilage. So basically any type of joint that has an injury, that has any sort of instability, you can use prolotherapy for.
Can it work if there is osteoarthritis, things like that? If
Absolutely.
There's,
Oftentimes when there's arthritis, it's because you have wear and tear on the bone.
Bone on bone, yeah.
It can be because of aging, but it can also be because there's instability in the joint. So it's secondary to the instability. If you tighten up and stabilize the joint, then you can minimize future damage.
So when you do prolotherapy, it just, the reason we did it on me is because I have an old injury and they take so long to heal. Why does it take so long to heal in a joint area, whether it's the knee or shoulder,
Right.
elbow, whatever?
So all joints are very poorly vascularized, so you're not getting a lot of blood flow. Blood flow is what brings in the healing factor. So if you can increase your blood flow to an area, you're going to increase your ability to heal.
Okay, before we look at the footage of Mike getting the prolotherapy done, walk us through what you did on our little jointers in here.
So this is a very small knee. Mike's is a little bit bigger than this.
Mine's way bigger. I got a huge knee.
So this is the patella or the
kneecap.
yeah, the kneecap right here. And if you open this up, you can see this is the inside of the joint. So the blue is indicating cartilage.
Okay.
What you have along the sides and inside are ligament structures. So ligament holds bone to bone, tendons hold muscle to bone. So you're always attaching onto a bone. Well, that's the weakest part of where the soft tissue attaches. So usually when you have damage on the attachment points. So what we do is I would take a needle and I would just inject into the area where there's damage. So with Mike, he had a lateral collateral damage.
We can move it over here.
Lateral
And
collateral,
I have a
what
little
does that
issue in
mean?
here. as
Lateral
well.
collateral ligament. So it's the ligament that stabilizes the outside of his
Right.
knee. So it's for this sort of a movement.
So you don't put the needle into the bone, it's into...
No, it's just to where the attachment point is onto the bone, not into the bone.
Okay.
But with Mike, so we injected a little bit here and a little bit here.
And what are
then
you
we
injecting
also injected
in there?
into the knee.
We went into
Yeah,
the
we
knee.
went-
Did you
we went
hear that?
right in.
Did you hear
So
how
we
brave I
injected
was? Right
into
in.
the knee as well. And actually we injected
Boy, that would
under
hurt
the
most
kneecap.
people. I won't even feel
And
it.
under the kneecap as
Under
well.
the kneecap as well, because that's a joint as well. So anywhere where you have two bones together creates a joint.
Yeah.
So with Mike, what he has is he has a deep bone bruise because he had some instability in the knee. So he needs to bring some
Ouch.
circulation into the area to
Yeah.
help
So
heal
whenever
that
the
bruising.
patella rubbed against the head of the
femur.
It would cause a little bit of pain.
with
and
the squatting.
Okay, let's look at with all the squatting.
All the
All
squatting.
the squatting that you do. He's doing it now.
See how well
Okay,
he squats?
I know,
Let's look
amazing.
at the footage of you guys this morning, and Heidi, maybe that you can walk us through. Of course, you're in our makeup room. If
We
you were
are.
in your office, you'd
wouldn't
probably
be-
be a little bit more comfy, but walk us through what you're doing here.
By the way, I just want to thank my stuntman for offering up his knee today as well. Appreciate
Okay,
it.
what are you doing?
Fine knee. So I'm just landmarking here. I'm marking the areas. We palpated around. That's some iodine. We're just cleaning the area to ensure that there's no infection. I'm getting a little bit
That's
of the
Kool-Aid.
solution. Yeah, Kool-Aid was
What is
we
that one
inject.
that you're injecting?
So a little bit of B12, that's what makes it red. But I also inject Procaine, which is a local anesthetic, and dextrose. And dextrose is the proliferative agent. Dextrose is what?
I'm totally not watching this, by the way.
Well, let me say, first of all, and I think you can probably tell, there was, I'm not going to say there was no pain, but there was very little pain involved in this. I mean, I could sort of feel it when you were putting the liquid in
Right.
because you're adding volume.
You're adding volume. So
But-
there's pressure, but
It wasn't painful.
yeah, you did
particular.
well. Yeah.
Now, Heidi, for someone who does have an injury and does decide to get prolotherapy, how often would they get this done, and how often would they see you, and how long would it take before the injury would feel better?
Right, so what happens is you do an initial injection, and what you do is you create a bit of a flare-up. So it's almost the opposite of a corticosteroid. This creates some inflammation, whereas a corticosteroid is an anti-inflammatory. What we're doing is we're bringing some inflammation into the area.
Yeah.
The inflammation creates healing. So it's a controlled inflammatory process. process. So you want the body to utilize that inflammation to the maximum amount of time. So I typically inject every 2 to 3 weeks. So what that does is it allows enough time between each injection that the body can heal and recover, and then you continue on with the next series of injections.
And how is this different? Because I've had neural therapy. I see a naturopath as well for injuries and that sort of thing. How does that different from
So neural therapy
prolotherapy?
is used a lot for things like trigger point injections, muscular damage, nervous system, when the nerves are when your nervous system is really holding on to a pattern. Whereas prolotherapy is more of a regenerative. It's an alternative to surgery when surgery is not an issue. So if you have a complete tear, so if you had a complete rotator cuff tear and you severed the entire ligament, you can't use prolotherapy because you need something. But if you have a partial tear, prolotherapy is a really great option rather than surgery.
Well, and as part of the post-operative recovery too, I can see this having huge benefits because obviously you're trying to do weight-bearing exercise to create muscle around it to help support the joint.
It works fabulous for all joints: necks, back, low back, SI joints, ankles,
So how
knees,
often
wrists.
should Mike get this procedure done?
So Mike's going to come back and see me in 2 weeks, and we're going to do it again.
How do you feel about that, Eki?
Let's see that
Squat and show off. Yeah.
Yeah.
Wait, you have anesthetic. It's probably not a great idea.
It's okay.
Yeah?
That's
with,
right.
With that small squat, he's not
It's
going to do
bike
any
to work
damage.
week, so I'm still riding.
Yeah.
I don't know how I'll feel in the morning, but as of right now, I'm still riding.
Feeling okay. He's still
Thank you very
frozen.
much. That was a great experience, and I look forward to continuing.
Well, I know a lot of friends who have done it for similar things, and they say it's
a
amazing.
fabulous treatment.
What
And
I'm
they see
looking
Dr.
forward to
Heidi
is
too.
getting rid of the pain.
Yes.
So that will be
Great.
very nice as we go
Good.
forward.
Thank
Thanks,
you,
Heidi.
Dr. Heidi. You can
pleasure.
visit Heidi's website to make an appointment or get a consultation with her to find out if the naturopathic approach is right for you.
And then you can squat like me. We're going to take a break. When we come back, Christopher Bates will be joining us, menswear designer, talking about some of his awesome designs. We'll be right back.
Heidi and I are laughing at you.
It's the sound.